When patients tell me, oh, I eat the best and I eat organic and I don't need supplements, my question is to them, so you all do the best. Do you feel the best? Question number one, where is the drainage of energy? Where is it all going? Most of US population has parasites. If you are an adult, you ate raw fish, you ate sushi, you ate fresh salad, you have them. That's how they work. So in order to keep body healthy and nourished, we need to clean up once in a while. We called India, China, third world country, where they do this anti-parasitic detox few times a year for everyone. And we developed United States of America are not doing it.
We are back to the 5-hour method. And today's topic, it's going to be fascinating one. But before we do it, how are you doing, Dr. Yuabova? It's a little colder there.
It is a little colder than usual, but we are doing well. Listen, changes everywhere. New York is changing, so Florida is changing as well, too. It's okay.
Yeah. Okay, let's jump into our conversation today. So, and I've seen a few of your videos you already saw on your social media about this topic. So this is great. Some people are tired because they are busy. And then there are people who are just exhausted, even after sleeping well, eating well, and doing everything right on paper at least. So today we are talking about one of the most misunderstood causes of persistent fatigue, which is parasites and hidden pathogens. And let's dive in. You've seen so many patients. So let's start with a real case study. Can you share a story of a patient who came to you with persistent fatigue and what initially didn't make sense? Let's start there.
Sure. So I'll start with the lovely individual who came last week. It's very interesting. This woman is only 42 years old. Her story itself is just very interesting. So she's 42 years old. She is not diagnosed with anything other than ulcerative colitis. Now she's ready to have babies, but her period has ended 10 years before then. So her body decided there is no more reproduction 10 years ago when she was 32. When we hear something like this, we also need to understand body always prioritizes self. Reproduction is optional. It's maybe I will do, maybe I will not do. But can I maintain my self-being or my safety, me, nutrients for me? So for 10 years, this woman doesn't have a period. She didn't really care about it. Wasn't planning of family. So that was not treated. Her ulcerative colitis was not treated appropriately. Diagnostic wasn't even done appropriately. So all of this time, she's still tired, exhausted, no energy, anxious, depressed with ulcerative colitis in a bathroom 6 to 12 times per day. Still the same thing. So when she came to me, that's the only thing she told me that she has and she's dealing with. So question number one was, where is the drainage of energy? Where is it all going? Obviously, it's going somewhere, right? If she's not holding on to it, supposedly she's taking supplements, she's eating well, not working. So where is she losing all of this to? Question number one. Question number two, why her body decided that she no longer has energy for reproduction. 10 years ago, her body decided no more. She was only 32 years old. So 32 years old, she was already menopausal. No more menstruation. Nobody looked into it. So we did blood work. Of course, I explained everything to her. I said, now we need to reveal. Consultation, we're already revealing. Questions are arising. Why is this? Why is this? Why is this? Why is that? Let's do blood work, a specific exam that I do with these patients. And I told her, I was like, I will not be surprised if you're going to show me that you have parasites in blood work. Firstly, if parasites in your digestive tract, and they could be anywhere, these parasites actually, they burrow through intestinal mucosa in and out, they damage it, and that's how ulcers happen. Also, we know in functional medicine that ulcerative colitis is an autoimmune condition. And what causes autoimmune conditions? It's virus, bacteria, parasites, and toxins. So this is, you see how I looped it together? So blood work came back. We have an AI interpretation, it's functional laboratory. And the first thing on priority list, intestinal parasites, 100%. There's also chronic bacteria, a little lower. I wasn't surprised to see this because I know how body works. So to me, to open it and see it, I was like, okay, well, I have already had an understanding that's what she's dealing with. So, of course, her desire now to have a child. And now she has already planned a embryo transfer. Think about it. Her body is depleted, no energy for herself for reproduction. None of this is being corrected. Some time ago, a few years ago, they got, collected an egg from her. They creating an embryo out of that egg. And now, without addressing all of this, the plan is to put this embryo in, implant this embryo so it can survive. So the body doesn't have energy for reproduction. What do you think going to happen to this embryo?
It's not going to make it.
Exactly. It's not going to make it. Body doesn't have enough for itself. How is it going to make it for another being? The system is brilliant. Understanding the system and how it really works and put these dots together, understanding what needs to happen for all of this to change will make a great change for this individual. It's just one example. I have a lot of examples that come through and they show different things. Male, he actually with me now for 8 months. Came 47 years old at a time, exercises, wakes up not great, tired, trying to do his best. Exercise regimen is there, cannot gain muscle mass. Can't understand. It's like, I'm doing all of this. I'm eating right. I'm taking minerals, vitamins. I sleep enough, waking up tired already, not putting on more muscle mass. He's actually losing muscle mass. Again, and I went through very specific, as like we need to understand if you're making this base energy and if it's not made and stored, where is this going? The same that blood work, I already understood it because his bowel was very specific. He's like irritable bowel. The blood test, and again, AI interpretation, intestinal parasites, 70%. So again, parasites not just in intestinal tract. They could be anywhere. They don't know the difference. But for females, what I see for women, we have great place for parasites, which is uterus, because it's very dark, it's warm, and always moist. And also has, it's round. It's like a bowl. If you are looking for perfect place, that's a perfect place to be. So I see this in and out, male and female. I see the same thing in children, the same thing. So in order to keep body healthy and nourished, we need to clean up once in a while. It is very important to clean up. Who cleans up and how it's done? Is it done appropriately? Are any proper steps are taking? That's the question. Because now you see on Instagram, TikTok, oh, detox this, detox that, la, 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 la. I get it. It's important, but you need to take proper steps to do it right. It's not just, let's start it from the beginning and here is the product and you take it. You make people sick like that. Because as we spoke about it last time, our last podcast, I said about cleaning the house, it takes energy. So there's no energy for being, there's energy for cleanup. Okay, detox takes time and takes energy.
And especially for the case that you were mentioning about that lady, what made you suspect the issue wasn't just, lack of nutrients or sleep, but it was actively draining? Can you talk about that a little bit?
So of course, I already understood, even if she said that she's doing everything right. Lack of nutrients, it's not primary, it's secondary. She was lacking these nutrients because those things are eating off of her. That's where the lacking of the nutrients, because they feed off the host. You're eating for yourself. You're not eating for yourself and plus for parasites. And parasites eat good stuff. They don't eat bad stuff. So seeing her and her physiological makeup, I already understood. She's extremely thin. There is no muscle mass. Whatever she had, she already wasted. So the way our body works, we have fat layer and we have a muscle mass. In order to maintain cellular function, we need energy. And if you don't have enough energy, your muscles goes as a fuel. So you feed off your muscle mass. There's nothing left for her. She's extremely thin. It's skin, some fat, and there is no muscle. So it's just, with experience that I have, and with clinical understanding of physiology, I already understand what I see because I've seen it so many times before. It's not the first time I see this. So in women who are in reproductive age, their reproduction usually stops before the normal age, as we say. So let's talk about menopause, perimenopause. Of course, perimenopause starts before even women understand it, but it happens in their mid-40s, perimenopause. It's another 6 to 8 to 9 years until they become menopausal. And now I have patients that coming in their early 30s and then full-blown menopause. And then people are thinking, oh, how could it be? Why now people are in this state of being? Because, body decides it's no longer necessary. Why would you do something you can't upkeep? You stop that and just concentrating on your core bodily needs, which is your brain, your heart, your lungs, and some digestion. some elimination. That's it. You can function this way. Very, very, very important to understand this. I still have, she's in the program. She's 42 years old, beautiful yoga instructor, absolutely beautiful physique, lots of muscle mass. But again, 42 years old, was never able to conceive, also completely menopausal, already 42. Did analysis, the same thing. Parasites. People come with different luggage, as we say. People without luggage are not coming because they feel great and there is no concern. It's great when people are proactive and you want to maintain the state of well-being. Unfortunately, who comes, they're already falling apart. So understanding their specific physiology and what they're going through, map a pathway for healing, specific steps. When do we nourish? When do we support detoxification pathways so they can excrete? And the right time when we actually suppress reproduction of the parasites. So people are thinking, you know what, I'm going to do this detox program. I'll kill all the parasites. The only way you can kill all the parasites when you kill yourself. They're so smart. I tell people all the time, they're smarter than us. They know how to survive. It's best when we function and live in symbiotic relationship. So it's enough for them, it's enough for us, and nobody bothers anybody. Most of US population has parasites. If you are an adult, you ate raw fish, you ate sushi, you ate fresh salad, you have them. That's how we work. We are on Earth as parasitic infestations. We are, is a human species. So by nature, we have things in us. The great state of being is being in balance, not disbalance. So when it's not enough nutrition for both, parasites take over and suppress immune function or exaggerate immune function. And then these reactions like ulcerative colitis, for example, because now system is reacting itself and to itself and destroying the bowel. There is no time for bowel to heal. So it is constant ongoing cycle.
How common is it for the people with chronic fatigue?
Very common. Very common. So we do this functional testing and AI interpretation comes 20%, but still body already recognized it, right? Something is happening. We don't really go through very deep detox. We go through support. And when we do another blood test in 6 months, its interpretation no longer recognizes there are parasites because there are now enough nutrition for both and this symbiosis. When it shows up at high 70, 80, 100%, we have to, the step number one, how we do it with my patients. Firstly, we feed the system. We need to give energy to do all this beautiful work. The feeding of the system can take 4 months, sometimes takes 5 months. It's very strategic. Also supporting detox pathways, such as kidneys, liver, lymph, and skin. We need to open up the doors. Open the doors. And then I use what's available. It could be medicinal. It could be herbal formulations to start cleaning up. So the natural cycle, if we're cleaning up some, the others live more eggs and they live about thousands per day. So think about it. Can we ever catch up? We can't. If somebody say, oh, I did this and all that, no, they're not. They're just non-detectable and they go in different layers. So ideal is to suppress their growth and to support systems. So the immune system can suppress and keep them suppressed as much as possible to have the state of balance. And that's the goal. That's how we can maintain state of living for individual themselves, enough energy. Plus, your parasites will be there, but they will be quiet. They won't be so loud. They won't disturb so much. And of course, reproduction then will be possible. By the way, Vivek, do you have pets?
Yeah, I have a small dog. Yeah, Maltese.
Oh, Maltese, wonderful. So where did you get the dog from?
It was from a shelter.
Lovely. So when you got this dog from the shelter, what did they do before they released this dog to you? Something you cannot
Yeah,
forget.
all these, the same thing, the breed and how it was bred, they go all the stuff.
Right. Didn't they do deworming?
Yeah, I think so. Yeah.
So before they release this animal to you, they did deworming. So when animals are bred, before they bred, the dog, the female, because she's now host, she's going to be carrying the puppies, she goes through deworming. Why is this possible? So she doesn't pass on the parasites to puppies because they go through placental barrier. Even though they don't do deworming when they're pregnant, when the dog is pregnant through this gestational period, when puppies are born, when puppies are proper age, they go through another cycle of deworming, just in case if somebody passed on. So you see, do we do this as humans? We don't do it. It should be happening because that's how we keep a state of balance. So for myself, I eat sushi. I'm a human being. I eat salad. So what I do 3 times a year I do parasitic detox. I do a very soft one. Sometimes I do a little bit harder one. It should be a part of living. We're keeping your system, ecosystem clean. How clean is it going to be? As clean as you can keep it. So we have all systems in place in our system and how to keep body as clean as possible. The step number one is our gastric juice, stomach acid. But what we see right now, most of the people in the United States don't have enough stomach acid. So people think they have too much acid and taking PPIs, proton pump inhibitors, Zantac, Tagamet. It's not great. It's not because you have too much acid, you don't have enough acid. But then we're killing more acid, we're neutralizing more acid. So the job of this acid actually to neutralize parasites that get into your system through your mouth. But when you don't have it enough, then voila, then you have these things that we're producing in yourself, in your body, because then it becomes their new home.
I see these days, especially our food chains are messed up a lot, right? And even for the kids, when they're eating berries and strawberries, and this has the most and stuff into them. And that makes me really scared too, because I don't know, like at what age you start even this detox, right? For the kids. Like what's your take on that? Especially, it's just our food chains are terrible these days. It's just parasites in everything.
So, firstly, washing your fruits and vegetables, it's number one. Teaching kids to wash their hands, not to bite their nails. Because if you take a smear out of what's underneath of the nail, you will see the critters. If you look at the microscope. So, teaching children what to do so they are as clean. Who is clean as possible? Nobody. But so their immune system is optimal. Also need to replace things so their vitamin D is an optimum level. So they don't have too much inflammation. So they can keep system and base as possible so they're not suffering with that. I do not treat young children for very specific reason. It's difficult. You have to educate the parents, for parents then educate the children, and then parents to make sure that children are doing A, B, C, D, and F. So yes, I'm specialized in family. So I can do children, newborns, geriatrics. I can do all of them. My practice right now does not allow me this time to spend all this time with the family. So I concentrate on adults. But we called India, China, third world country, where they do this anti-parasitic detox few times a year for everyone. And we developed United States of America are not doing it. And what, is it true that we don't have parasites? I have evidence we have. My patients. It's not my patients are not educated or they're poor, they're highly educated and they're financially stable and they still have them. So the social ladder has nothing to do with that. But we need to have things in place and we need to educate individuals and telling them, stating that it's very important to keep their system as optimum as possible and as clean as possible so the body can function at its best. So for this individual who I said that, he had parasitic infestations, when we cleaned it up, now he has muscle mass and it's just, he's just growing it because energy that he needed to grow his muscle mass was wasted to something else. Now we suppress them. His body now have enough energy to do all of this. And he looks great. He looks probably 15 years younger than he was. He lost some weight and he wasn't heavy. I wouldn't think that he had something to lose. But the way body changed, it's just amazing. You just shift it. You're not feeding extra, you're feeding yourself. And that makes the biggest change, where now we have nutrition available for body to heal and for optimum function.
I'm going to talk about why this is missed in conventional testing. But before that, I want to share a personal story here. And someone in my close relationship, this 40-year-old, this lady was pregnant and she started having a lot of pain, pelvic area, just before the day of or a couple of months before pregnancy. And she tried to tell everyone, doctors and everyone, like, hey, it's paining a lot. It's hurting so much. I don't know what's wrong. Maybe I'm going to deliver baby sooner. Check it out. And all they said is, no, 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 this is just pelvic pain, pelvic exercises. And she was literally walking like a penguin. She couldn't walk to the day of pregnancy. And then when the pregnancy happened, along with that, on one side of placenta was the baby. On the other side was a big chunk of who was sucking the blood and big mass with it red. And that was explanation goes to what you are saying, line up to that. This thing was fighting with the baby. Somehow baby survived, came out. But I saw the picture, it was sent to me, and this was this big, my hand, and came out with the baby. They released it and cut it. And everybody brushed off. And this is crazy to me. While she was walking like a penguin, literally, like small steps. You cannot walk for 2 months before delivering it. So what is wrong with the system? Like conventional testing, just brushed it off. What is the problem here? Why can't we not like really catch these things?
So I will tell you that when I started practicing, I used to test a lot of stool. I stopped doing it because I had patients who showed me pictures of parasites that would get out of toilet. And I would ask them, I said, you know what, I'll send you this container. Please deposit these, whatever you found in the container. I would like to know the species. They would send it to the lab and it would come as absolutely within normal range. Nothing found. So I stopped testing this way. The way I test right now, this AI interpretation is looking, I do the same thing, looking at the blood work analysis and looking at least 5 different factors to understand if there's somebody's feeding of the system. Because you see, number one, not enough gastric juice. Not enough gastric juice, 100% you have parasites. Number one. Eosinophils, basophils, what number? Iron, more, less, too much. All of these things, if you put them together and you understand biochemistry, you'll understand that these already showing you they are parasites. So you don't need to do stool analysis. You don't need to be doing sonograms. And again, even if you're doing stool analysis, you're checking for parasites in the digestive tract. What about everything else? I remember a couple of years ago, this actually made national television. So they showed this woman in Australia complained of headache. Headache. She went to do MRI and CAT scan. They scanned her and they found a lesion in her brain. So no other choice to do. They had craniotomy. So the surgery, opening up her head, like making skull a hole, and a neurosurgeon, and it was video recorded, found the lesion and wanted to cut lesion out. The problem was as soon as she looked at the lesion, it started moving. So she took an instrument that was blunt enough not to damage the skull, the tissue of the brain, and she pulled it out, and it was long parasite in the woman's brain. So how is this possible? Because we have blood-brain barrier, like we have blood placenta barrier. We, by nature, have specific safeguards in place for those things not to happen, right? So these parasites don't get into the brain. Why? Brain is so important for us to survive. We need brain working because all signaling entire system happens here. But when we are inflamed and tired and very toxic from environment, this barrier loosens up and the opening up the holes through which eggs of parasites can get through. And they can latch on the brain and this thing develops there. See, like we are not living in perfect environment and it's nobody else's fault. This is what's life right now. Food is not great. We spoke about it. Water is not great. Air is not great. Nothing is great. We are still here. We need to make the best of it. That's why education is so important so people understand how this works and how to make it so it benefits you. We have what we have. We have to learn to, adjust. And what we need to do when patients tell me, oh, I eat the best and I eat organic and I don't need supplements, my question is to them, so you all do the best. Do you feel the best? I understand you eating organic. Oh, no, I'm always tired. Well, why? Because this nutrition that you're eating no longer delivers what should be delivering. So the only options now we have to supplement. I supplement, all my patients supplement. It's not something I'm not doing. I'm doing the same thing. I supplement so my system receives what it needs to receive for best functioning. That's reality.
Yeah. And once, let's say you have identified what was actually going on, and then what change in patients' energy or symptoms after you put them on your protocols and how quickly that works. Can you walk us through that, please?
Sure, definitely. It works very quickly. So as soon as we start replacing what's missing, even knowing that they have parasites and they're feeding their parasites, within 2 to 3 weeks, they're already telling us, oh, I have so much more energy. Now I actually can go work out. Because yes, now we are supplying enough for both. I have no choice. I have to feed this and I feed the system. If I just feed the individual and I know there are parasites, I know they're feeding off. So how much is this patient getting? Not that much. So I have to feed both for some time, preparing the system, the patient system, for cleanup on month 4, 5, or 6, depending when they are ready. I want to make sure their liver is optimum, kidneys are functioning, lymph can move. If lymph, so it's fluid that we have, our lymphatic system is moving out, if the fluid itself is gelatinous, thick, usually happens to people who have high systemic acidity, not proper pH balance, nothing I can move out of. So I have to liquefy it. So it moves at the same time. What patients tell me, they report that they feel better, more energy. They can do more things. Everybody wants to see parasites in their toilet. You're not going to see them. A lot of times they are microscopic. You won't see them in your toilet. I remember I had a very interesting case. Let me share this with you. A patient that I'm working with her now, 4 years together. She wants me to help her maintain her well-being. So we worked with her then already a year, and she was great. Energy and all. She went on vacation. After she came from vacation, she said she had a little situation there where everybody in the bus got poisoned. Everybody had stomach upset. But what she complained with when she came to me was cough. It's very weird cough. She's like, I'm coughing, and that's very weird because this cough is not going away. She already went to her primary care provider, and the primary care gave her 2 rounds of antibiotic, and so she's still coughing. So I did my own examination, sent her for x-ray, and what they found for chest x-ray, they found lesions that were scattered throughout her lungs that were very circular. You could see the balls. And I started asking her questions like, listen, when you got sick on your vacation, is there any chance where you're throwing up and it's possibility for you choking on your throw up? And she said, yes, it happened. Listen to this. So what she got something digestive that resides in digestive system. But when she was throwing up and choked on, basically she inhaled it and now it got into her respiratory system. They're looking like peas, round. So lesions that are made in lungs, they don't look perfectly round. Like if anybody has any kind of cancer lesions, any kind of lesions, they're not perfectly round. These were perfectly round and diffused all over the lungs. On one was 4 and the other one was 3. I was like, okay, I understand what this is now. Now we're going to treat it very specifically. So I put her on very specific protocol. So she was on herbals, antiparasitics. The same time is to get them out of her system, as well as because lungs are closed system. You can't poop them out. They are in the lungs. So I needed to use something that will help break them apart and eliminate on cellular level. I think she was on this protocol for 8 weeks. Her cough stopped. Everything stopped. Done. Of course, I told her, since those things now in your lung tissue, it's possible because when we're stopping their growth, it's very specific herbs that do that, these lesions can calcify. And if they calcify because there is no elimination process out of the lung tissue, you can't get them out different way other than moving the lymph. If you have anything remaining, you will see it on x-ray. And out of all the lesions that she had in the beginning, she only remained 2 that calcified. Everything else we took care of. So no more cough. And it was very specific. I'm tired all the time. I wake up in the morning, at nighttime, at daytime, I'm tired. I cough all the time. What kind of cough you have? Oh, it's non-productive. So there is no mucus. It's just cough, irritation. So what is this irritation? 2 sets of antibiotics done, still coughing. What else could it be? Think about it. So getting a story. What is she telling me? So I would be able to guide her. It was absolutely amazing. So we did it.
Yeah, this is fantastic. And for the people whom you're treating, right? Like when they are in this cleanup process, is there any, like how difficult it is? Are there withdrawals, or does it take toll on the body, or you feel like, bad, like, oh, I'm doing this thing?
That's why when I create specific programs for them, I guide them step by step so they follow to avoid all of these. That's why preparation stage is very important. Prepare the system so it can do it. Enough energy and all doors are open. Then everything is always adjustable. Herbs, they are very strong. Sometimes you do too much, your body will feel too much. And I educate them. If you feel A, B, C, D, and F, you reduce those by 50% to 2 to 3 days. In 2 to 3 days, it will stop. Then you increase the dose again. And again, I'm always open for communication with patients. My coaches know the process, how to do this. So even if they feel something for a day or 2, usually they don't feel anything because they prepped. That's why I don't hurry. I don't rush them. We do things right and right time, first time. We do it right so they don't have any kind of adverse effects. This is very, very important. The planning and how to guide patients through this process, it's very important. And of course, I educate my patients. I was like, listen, we're doing this. It's a lots of work. It's your job and you have to prioritize your well-being. You need to understand that you need to keep your home, your body clean and functional as much as you can. And we need to do this often enough. 2 to 3 times a year. Everybody that my patients are doing cleanup 2 to 3 times a year. Different type of herbs, different type of tinctures. We keep their lymph fluid enough so they're not in acute state of inflammation. That's very important. Inflammation itself takes so much energy, keeping the balance of inflammation. So it's very specific process.
And for the people who've been on your protocol, they made great progress. They got to their highest level or better level. Now what? Now afterwards, how do they sustain that? What's the protocol for that?
So we always, most people that they come, they stay with me and they don't go anywhere. They understand the value. But there are also people who say, you know what, I'm good and good. I'm going to do my own thing. We explain it to them because everything that's good needs maintenance. We educate them a lot. They already know what their body needing. And we're also keeping door open. When you decide and choose that you want to hop back on so we can optimize you again, so you can maybe then you'll understand that you need maintaining it, you're more than welcome to come back. People come back. But the best when people don't leave so we can constantly guide them. But again, we give them so much education so they understand. Even how to deal, for example, with a virus so they can overcome this virus. We teach them even that. Points of hygiene are very important. Don't overwash your hair. Don't overuse the soap. All in the culture. It's always you never clean enough. Shower in the morning, shower at night. Wash your hair every day. Why you have to wash your hair every day? You're gonna end up bald. Why are you breaking all the hair follicles? They get destroyed with the soap. It's harsh. Teaching how to do this, cutlery or what, containers to use, how to make food. We teach a lot. So patients, that is always with them. That's important. The base nutrients, what's the best and how to deliver these nutrients the best to your system.
That's a lot of things to carry for patients to take over, right?
Yeah, well, we have Patient Academy. It's a lot of information. It took me some years to create all of this. They sit and they watch in their own leisure. It's for them because we are not, you're with me, I'll guide you and you depend on me. No, no, no. I want to give it to you. You have the knowledge. So you can take care of yourself. That's so important. Take care of yourself.
Of course, sustaining as it happens and there is a whole thing going on. People have to follow the protocols, and then there will be some people who will be with you, some will be trying to do things by themselves. But let's say just for people who are listening, right? And someone who's feeling constantly depleted and they're just like out of energy, even though they eat right, they look okay. What do you want them to like pick their own signals? What are a few things they should know on daily basis they should be capturing so that they even know at least that I need to go and reach out to somebody like you to do further analysis?
Definitely. So if anybody doesn't feel their best, no energy in the morning, not very happy, always stagnant, had to force themselves to function, it's not a normal state of being. Look at the eyes. Is there that shine that should be there? Like I'm looking at your eyes, you have this beautiful shine, this desire to live. Those people who are internally exhausted, there is no shine. There is no desire to live. You see this, you know that they're already worn out. They need support. The hair, how hair is looking. Is it enough hair? Maybe it's not enough. The nails, are they brittle? For male, a lot's about sexual performance, how lively you feel like. But we are not about sexual performance. We're about well-being, What is their well-being? What are they feeling like? Do they have enough? Do they feel like they can sexually perform? And what the sexual performance level? This is all things that you can pay attention to and compare. 5 years ago, was it the same or wasn't it? Is it very different than it was, or is it the same? If you see a big difference and you're still a young individual, so your age is really just a number, when you are optimally managed and you know what your body needs, even at your 60, you should be functioning as you're 40 because you have everything. Your hormones are optimized, your nutrition is optimized, you're not inflamed, you're resting well, you are delivering nutrients to your system, so you will be functioning at a different level. Now what I see, 25 years old, and to me it looks like they're 75. It is sad. I'm not laughing. I'm like, my God, where are we going with all of this? With these young people, firstly, diseases are getting so much younger. We have chronic diseases that are getting younger. All young populations, either depressed or anxious. Most of them have gut issues. Guys, not sexually active, and they don't desire that. They have no energy for that. That's a new reality. People think it's normal. Is this normal, really? It is not. It's not normal. Normal should be you're 20 to 45. You should be hopping like a bunny, being happy, doing things that you wanted to do. Create family, have a job, career that you love having, develop. It's a different reality. We live in different time. It's challenging for most people, very challenging.
On the optimistic side, like, there is so much development going on in tech side, AI, all that stuff is coming up. Where are you seeing all these things for the good in the good direction, where it's moving? Are you seeing anything that's coming like, oh, there are now better supplements coming, or there's better technology coming and better interpretation coming through because of AI? What's the optimistic view as we are seeing the progress?
So what I will tell you, I start using AI interpretation for my patient because I can interpret everything just fine. It's different understanding physiology. But why I onboarded this AI interpretation? Because I wanted my patients to see it so they can read it. It is very important that different companies are doing it. I'm comfortable with what I have because it just delivers it in right language for patients. So patients can understand. Before AI was available, I would take basic blood work and I would tell patient this, and this is not okay. And I understand it's not okay because your signs and symptoms correlate with this. So we need to make a correction. They would say, I actually went to see my PCP a week ago and he said it all was with normal range. So nothing needs to be done. And then this question arises, who is saying the truth? And then I was, okay, your PCP told you nothing to be done, but are you feeling well? If you're not feeling well, then we need to do something about it, right? So now I have to explain more. Now is AI interpretation here. Now you can see this is how it actually works. So for lots of providers that can't even put these two and two together, because the way to understand somebody else's blood work, especially functional, it's knowing the art of it. It's not so easy. One number doesn't mean just one thing. Combination of different factors means something. As I told you how this AI interprets the parasites, how I interpret the parasites in the system. You look at the different markers to understand one problem. So for functional providers, this AI making a possibility. So they can now really understand where problem coming from. So they can understand how to treat patients appropriately. And yes, it's beneficial. I look at it as benefit because I would educate somebody how to do this. How many people can I educate? Having this AI helps many more providers, so we can help so many more people. Of course, creating a specific protocol for individual, again, it's another art of healing. And AI doesn't do this. It gives some funny interpretation and funny recommendations. It's not appropriate. No, it's not appropriate because there are more things we need to understand about individual. What their gastric lining, is digestive tract working? How do we heal it first before we give nutrients so they actually gets absorbed? You see, it's a lots of different steps. But yes, the way we have AI, it's making lots of things much easier for providers and for the patient. But what I don't like that the patients put their blood work through Chat GPT and then they have panic attack.
Yeah. It's like you're almost dying.
Most of the time it shows the truth. Like I had this patient, she actually was my patient about a year ago. She was 36, 37 years old. She came for fertility. I did her blood test and we specifically scheduled them so I can explain everything. So she wasn't patient enough. So she put this blood test through GPT and then she starts calling and in hysteria and panic. Of course, I picked up the phone. I knew already what she did. She's like, oh my God, it says I'm never going to have children, for my fertility is finished. We want to avoid that because it's your current state. It doesn't mean you have to remain in the state forever. There is a way to reverse this, So that's so important when provider explaining it to patients. Yes, you are like this right now, but 6 months from that, you will be a different person because we can correct all of this. So they can understand there's the changes available. It's possible. You just have to follow proper steps. And ChatGPT just throws it here. Information you asked, I said, all of this is not, there are no possibilities. There are no map. There is no guideline. So that's important. That's why I ask my patients, we did your blood work. We don't release it to them until we have an appointment. So I have a chance to explain to avoid all of this.
Yeah. At the end, AI is still a whole bunch of information, right? You still need somebody who's an expert to interpret, connect the dots, make a protocol that's for you. And that's what it is, right? People think that it's just some magic doctor will come out of that and tell you everything. Unfortunately, that's not the case, right? It's how is this different from Google? Google is the same. It was giving you all the information anyway. So that is a wrong view. You should use things to track it. Use your ideas and get new ideas. Great, and it's a good way to be aware, ask questions. But it's not a tool that you can just think this is it. This is the doctor. The tool is not the doctor. The tool is a tool. That's what it is. So that's a very key message too. But of course, optimistic view is yes, it's adding, helping providers, helping patients.
Yes, definitely. So the way we address it, the way I address it, it's not optimistic view, it's realistic view.
Realistic.
Realistic view. It's not optimistic. I never tell people something that we cannot attain. I tell them exactly what's attainable because we've done it.
Yeah.
You know, patient comes and a whole bunch of parasites and they're not so good at the end, 6 months. Yes, they have so much energy. They are so feeling great. They feel their best, like how they felt 30 years ago. We do blood tests and there is no more evidence of parasites. Wow, I didn't think it's possible. We do it all the time, but we need to clean them 2 to 3 times a year. We need to clean everybody 2 to 3 times a year. That's appropriate thing to do. And again, I choose something very gentle, very soft, doing it right and right sequence. And sequence is different for each individual. Understanding what has been affected, how much energy will be spent to do this, because it's a job to do. You know, they need to do this, and supporting system throughout to do this. That's what's important. People think like copy paste program, it won't work.
Yeah. Well, this has been great. Thank you so much for sharing your insights today. And for our listeners, if you have persistent fatigue, don't ignore it. It's a signal. And sometimes it is your body asking for help and it's hidden and you don't know. So, not asking you to push harder. It's not about eating right. It's not about lifting more weight. It's about really looking into this. Again, we have experts like Dr. Yuabova, and you should come and schedule your reveal consultation at National Wellness Group in Boca or visit nationalwellnessgroup.com. And yeah, keep listening to this podcast here. Learn, be aware, and ask questions. You don't have to live the way you are living if you are waking up not excited about it or tired. These are signals. Just capture it. Any last word, Dr. Yoba, from your side?
Absolutely. I wish everybody the best of luck. Firstly, I would like for everybody to be as happy and as healthy as possible so you can enjoy this life. We're living in very interesting time of transformation. It's not just AI, also we are transforming. So please don't hold back. The transformation is everlasting. Like you transform and hopefully you're transforming upwards, not downwards, right? It's time for upgrade. So if this time is for you, step up, step forward, and go through this beautiful transformation. It's all for you.
Here it is. Step up, step forward. Thank you for joining us. We will see you in the next episode of the 5-Hour Method. Thank you.